welcome to Endless Nurses World. In last video we'll studied about body fluids and electrolytes. In this video we'll studied about concept of body fluids and electrolytes. What are the concepts? First one is electrolytes, body fluid compartments, third spacing, edema, body fluid transport, movement of body fluid intake and output, maintaining fluid and electrolyte balance. First one is electrolytes. Electrolytes is a substance that dissolved in ionized solution, that means ionizes. That is, some of its molecules split or dissociate into electrically charged atoms or ions. Electrolytes is a substance it dissolving in a solutions. Ion is an atom. Ion is a atom. It carries a electrical charge. It may be either positive charge or it may be either negative charge. Atom is the smallest part of an element. It has three particles, namely proton is a positive charge, neutron is a neutral charge, and electron is a negative charge. Protons and neutrons are in the nucleus of the atom. Therefore, it carries the positive charge, and then electrons carry a negative charge and revolve around the nucleus. So there may be same number of electrons and it may be the same number of protons. It may be an either positive or negative, and there is no net change. And the atom is not a neutral one. It sometimes it gain and sometimes it loss or sometimes share the electrons. Molecule. What does mean by molecule? A molecule is a two or more atoms that combine to form a substance is called molecule. Cations. What does mean by cations? Cation is a ion. Cation is a ion that has given away or lost electrons. Therefore, the cations is a positively charged ions. Cation is a positive charged ion. Some of the cations are sodium, potassium, calcium, and magnesium. Anion. Anion is an ion. It carries the electrons, so it having the negative charged. Some of the examples of anions are bicarbonate, chloride, and phosphate. Electrolytes measurement. So in metric system, the volume of fluids it can be measured by fluid liters or milliliters. The unit of measure that expresses the combining activity of the electrolytes is the milliequivalent. The electrolytes is measured by milliequivalent. 1 milliequivalent of any cation always reacts chemically with 1 milliequivalent of an anion. So what they are telling means 1 milliequivalent of anion cation reacts with the other number of anions cations. Body fluid compartments. Fluid in each of the body compartments contains electrolytes. Each compartment has a particular composition of electrolytes which differs from that of other compartments. The compartments are separated by semi-permeable membranes. Intracellular fluid compartment having the increased concentration of potassium, phosphate, magnesium, and protein. When there is the extracellular fluid in plasma, blood plasma having the increased concentration of sodium, chloride, bicarbonate, protein, and there is interstitial fluid having increased concentration of sodium, chloride, bicarbonate, and there is the decreased level of protein. Then to function normally, the body cells must have fluids and electrolytes in a right compartment in a right amounts that should be maintained the right hemostasis to the patient. Whenever an electrolytes, not a patient's, are human bodies. Whenever an electrolyte moves out of a cell, another electrolyte moves into takes its place. That is, a number of anions, number of cations must be the same for homeostasis to exit. Body fluid compartments, namely intravascular, intracellular, extracellular. Intravascular, vascular means blood. That is fluid inside a blood vessel. Intracellular means the cell of fluids inside the cells. Most body fluids are inside the cells. Extracellular compartment refers to fluid outside the cells. The extracellular compartment includes the interstitial fluid, which is fluid between the cells. Blood, lymph, bone, connective tissue, water, and transcellular fluid. This is a body fluid compartment. Then intracellular contains 2/3 and extracellular contains 1/3 of the body water. Third spacing. What does mean by third spacing? So third spacing is a accumulation of and sequestration of trapped extracellular fluid in an actual or potential body space as a result of disease or injuries. When there is accumulation of extracellular fluid in the some spaces, that is accumulation sequestration of trapped extracellular in the some of the body parts. Then trapped fluid represents the volume loss. It will lead to volume loss and it will affect the normal physiological process. Fluid may be trapped in body spaces such as pericardial, pleural, peritoneal, joint cavities, bowel, abdomen, or within soft tissues after trauma or burns. Third spacing fluid loss, we cannot able to identify whether we are checking the weight changes or intake output charts. When there is organ malformation occurs, in that condition only we can able to identify the third spacing fluid loss. Then edema. What is meant by edema? Edema is the excess accumulation of fluid in the interstitial space. It occurs as a result of alteration in the oncotic pressure, hydrostatic pressure, capillary permeability and lymphatic obstruction. So there is any differences, there is any variations in the pressures which will lead cause edema. Then there is lymphatic obstruction, the fluid retentions will be there. Localized edema, there is two types of edema, localized edema and generalized edema. Localized edema occurs due to the traumatic injury, accidents, surgery, local inflammatory process or burns. Generalized edema occurs due to excessive accumulations fluid in the interstitial space throughout the body as a result of problems in the cardiac, renal or liver failure. So generalized edema also called as anasarca. Body fluid. Body fluid transport nutrients to the cells and carry waste products from the cells. Total body fluid amounts to 60% of body weight in adult, 55% in older adult and 80% of the infant. So the infant and older adults are higher risk for fluid related problems than the infants having the higher risk of fluid loss. Constituents of body fluids. Body fluid consists of water and dissolved substances. The largest single fluid constituent of the body is water. Some substances such as glucose, urea, creatinine do not dissociate in solution. That is, they do not separate from their complex forms into simpler substances when they are in a solution. So, in some solutions they will dissolve or dissociate, split into two parts. For example, sodium chloride split into sodium and chlorine. These are all some concepts of fluid and electrolytes. So in the upcoming videos we'll see the remaining concepts of fluid and electrolytes. And thank you so much. If you are liking this video, you can subscribe to me and ring the bell button also. You will receive my notifications, and thank you.